Hello everyone, welcome to Dr. Sam's anatomy classes. I'm Dr. Azmi Mohsin. I'll be teaching you optic nerve today. Optic nerve, is the nerve of sight, nerve of vision, and it's the second cranial nerve. First and second cranial nerves, they are misnomers. Actually, they're not nerve, they are extension of the CNS, the diencephalon, from the forebrain. And the peculiarity about this optic nerve not being a nerve, the reason is that there's a peripheral nervous system that includes the spinal nerves and the cranial nerves, and these nerves, they are myelinated by the Schwann cells, and they form a neurolemmal sheath around those nerves. And because of that, there was an advantage in this peripheral nerves that if there is any exanthemosis type of injury, there is chances of regeneration of the nerve. But this optic nerve has no neurolemmal sheath because it's not the myelination here is by myelination here is by oligodendrocytes. Okay, so and that all the tracts and the fibers within the CNS, they are lined by myelinated by the oligodendrocytes. So it's compared to the tracts of the CNS. Another thing is those peripheral nerves, the spinal and cranial nerves, especially the sensory nerves, the first order sensory neurons, they receive the stimulus, the impulses from the peripheral receptors, and they relay these sensations into the CNS. Got it? So basically the sensory nerves, they are all formed by the first order sensory neuron, while this optic nerve is formed by the second order neurons. Okay, so these are the two main reasons why this optic nerve is not a nerve and it's called a tract. So remember these two important things about the optic nerve. So let's begin with this optic nerve. Okay, so before starting, let me tell you about the optic nerve, how it commences from the eyeball. So this I'm drawing is the eyeball, right? So this is the eyeball, and this is the optic nerve. Here it forms the optic chiasma as well as the optic tract. Okay, so just behind to this central axis, the visual axis, the optical axis, on the posterior pole, there is this area for the brightest vision, the fovea centralis and the macula. And this area from this where the nerve commences, this is called the optic disc. Previously in my lectures of retina, if you remember in the retina part 3/4, that lecture I had shown you how these peripheral nerve fibers continue down in this optic nerve peripherally, right? So here you seeing in the eyeball that these nerve fibers first they cross the nerve layers, that's the ninth layer, this is the ninth layer, that's these nerve fibers are actually the central fibers of the ganglion cells. So they they emerge first, they cross the peripheral nerve fibers, then they become close to the vitreous, and then they pass down here, so that they become central in the optic nerve. This is the pattern. While the fibers from the macula, they just pass from the just pass medially, and they become centrally placed in the optic nerve. This distance here is hardly 2 to 3 millimeters between the optic disc and the fovea centralis. So this is how the optic nerve is formed by the by these sorry, these are the central fibers, like central fibers of the ganglion cells, and they form the ninth layer in the retina, and those fibers they converge towards the optic disc, and they pass on to the optic nerve in the same pattern. The the image formed on the retina as it is transmitted from the optic nerve to the optic tract, LGB, and then through optic radiation in the visual cortex. Okay, so that was just a beginning. Now you see about the visual and orbital axes. So visual and orbital axes mean what you find here, that this is the two orbits, their medial wall are parallel to each other, while the lateral walls are perpendicular to each other. Okay, and the eyeball is placed here in between the orbits. Remember that the eyeballs are placed in between the orbits such that it doesn't touches either of the walls, neither the roof, the floor, the medial nor the lateral wall. It's like fixed in position by the median lateral check ligaments. Then below to the eyeball there is a suspensory ligament of Lockwood, right? That's a fibrous sheath enclosing the inferior rectus, inferior oblique, and that's how. And behind that is the retrobulbar fat. So eyeball is like fixed in position, and don't forget that there was a smooth muscle which bridges this inferior orbital fissure, the orbitalis muscle, that also helps in maintaining the anteroposterior stability of the eyeball, or rather helps it in fixing the eyeball. So if it gets paralyzed, remember orbitalis, if it gets paralyzed, and remember in case of Horner syndrome, because it's a smooth muscle innervated by sympathetic fibers, so there is what happens is an ophthalmos results. Anyway, so now you look here that if this normally this is a normal pattern where you find that the eyeballs are focusing in front, and so from a distant ray of light, this is the ray of light with its principal axis, it strikes on the posterior pole of the eyeball. So this is called the axis of the eyeball. Okay, and this one you can see is the axis of the orbit. Okay, so this is the axis of the orbit, and this is like the axis of the eyeball. So together you can say the angulation formed between the visual and the orbital axis, this angle here is formed, and this is around 23 degrees. Okay, remember this. Next we are seeing is the orbital dimensions. So the two orbits you are seeing here, right? And as I said, the medial walls are parallel to each other, and you can see the length of the depth of the medial wall is around 50 millimeters, right? So it's 50 millimeters, the length of the medial wall. Similarly, now look at the lateral walls. The lateral walls, the length is same, right? And that's why remember that the orbits are four-sided pyramids with their apex directed backwards and medially. So the lateral walls, you can see they are at 90 degrees to each other. Okay, then at the apex and you see here the base of the pyramid, or you can say the diameter of the aperture of the orbits is around 40 millimeters. Okay, now look here at this optic canal, and this optic canal is around 5 millimeters in length. Okay, one thing is this. Then look here, the curve, the diameter of this optic canal keeps changing. So its opening towards the orbit is a vertical opening, vertically elliptical, while its opening posteriorly in the cranial cavity is a transverse oval in shape, while the middle portion of the optic canal is circular. So if you have to remember this, just why not just revise something from the past so that it becomes easier to remember this portion also. So if you remember the penile and the male urethra, right? The male urethra, when it comes out from the bladder, it continues like this, right? And this is like the male urethra, and here you are seeing is the membranous portion of the male urethra, and actually a little more, if I want to be more realistic, more symmetric, so I need to draw it a little better diagram. So look here, it's this bladder, and from this bladder it continues down after perforating the pelvic diaphragm, then it bulges down and continues as firstly the fixed portion, that is the bulbar urethra, then the suspended portion, the penile urethra, and at the ends you have the terminal urethra. So remember, while you must be taught about the male urethra, the cut sections. So at the terminal urethra, the cut section is vertically elliptical. It's vertically elliptical. And the cut section of the penile urethra is transversely elliptical. And the cut portion of the membranous urethra, look here, hold on, this will be the sphincter surrounding the pelvic diaphragm through which it's piercing down. So this will be the membranous urethra, and the membranous urethra is crescentric in shape, in cut section, and the prostatic urethra here, prostatic urethra is like crescentric like this, slightly H-shaped, but it is crescentric. If you remember the opening of external os in the uterus, in the cervix, the similar manner you find is the cut section of the prostatic urethra. So it is called, this one is crescentric. So there is less of space, I cannot write everything, so just keep remembering this is the prostatic urethra, and it is, this is crescentric, this is membranous urethra, and this is stellate in shape, and this is penile urethra, and this is transversely elliptical, and this is terminal urethra, and this is vertically elliptical. Okay, then there's one another tubular opening, and that's called external auditory meatus, right? External auditory meatus is also like this, although it's not, it also has a curved portion, the late cartilaginous, the medial one is the bony portion, but the purpose of telling is the cross sections. And if you see, this is also like this, it has a narrow portion in between, and the outer terminal portion which faces the towards the auricle, this external auditory meatus at its opening externally is vertical opening, vertical elliptical. Okay, this is vertical and elliptical. while the inner one towards the tympanic membrane, this is transversely elliptical. By the way, I'm using this word elliptical, but it's not very much in elliptical, because the diameter here is 10 by 9. So it's not very much, it's like 10 by 9 millimeters. So it's not very much, but at least because I'm revising the tubular structures with the diameters and cut sections, so making you remember this thing. And if it's asked, like, the narrowest portion of the external auditory meatus is this, and this is like 5 millimeter away from the tympanic membrane, and this portion is called isthmus, and it is the narrowest portion of the external auditory meatus. So remember that this end of it is medial end, and it is the lateral end of external auditory meatus. Okay. So why was I revising? Because so that you remember which is the vertical and the transverse end of the optic canal. As you've seen in all these three structures, I have told you the outer opening means, in case of this canal, optic canal, it's towards the orbit. So the outer opening is vertically elliptical in all these three tubular structures. So this way you can remember about the optic canal as well. Okay. So next you are seeing is the passage of light through retina. So in this diagram you are seeing, this is how a ray of light from a distance approaches the eyeball, passing through this cornea, anterior chamber, pupil, posterior chamber, anterior capsule of this eye lens, then posterior capsule of the eye lens. Then this is how straight passes and strikes onto the posterior pole, and there is this fovea centralis, the area of the sharpest vision, and surrounding to that is fovea centralis, the macula lutea, the area of clear vision, and 2 to 3 centimeters, 2 to 3 millimeters medial to that will be an optic disc. So, and that this ninth layer, the nerve fiber layer from the ganglionic cells, they all move and converge to this optic disc, and from there they pass out, and the pattern is such that the peripheral fibers will stay peripheral in the optic nerve, the central fibers will stay central in the optic nerve. Okay, so if you know that, now let's see this area here that has been zoomed here. So let's see how it is happening here in this eyeball. So look here, that the light when it strikes from this is the vitreous, right? This is the vitreous, and this is the outer portion. The red one is the choroid, the green one is the sclera, and the yellow portion is the retina. So light rays, when it's crossing actually all the layers of the retina. There are 10 layers, remember. So this first strikes this is the 10th layer, because remember we number the layers of the retina from outside to inside. So it's how this is the layers of the retina. So the light rays, when it passes through all the layers, it goes into the depth of the retina and strikes there at this first layer, which is pigment epithelium. But before that it strikes the second layer, and the second layer is layer of rods and cones. So and first layer is the pigment layer which absorbs the bright light. Now before that, the rods and cones, they get stimulated, and they convert this visual stimulus, the visual energy, into electrochemical stimulus, and with that electrochemical stimulus there is an action potential generated, which is now conveyed along to this pathway that's called the visual pathway. So first of all it strikes to this this first number one neurons are actually there are three layers of neurons. The first one are the modified rods and cones. Second one are the bipolar, these are the bipolar neurons, and this one is the Golgi cells, sorry, ganglionic cells. These are the ganglionic cells. But calling them in graded order, remember we don't call them as the first order neurons here in the visual pathway. Layer of rod and cones is the layer of photoreceptor. This is a layer of photoreceptor. So bipolar neurons are actually the first order sensory neurons, and this ganglionic cell layer, this ganglionic cell layer is the second order neurons. So the central fibers of the second order neurons, they move towards the optic disc and then they descend down along the optic nerve, passing through this cribriform lamina and emerge out there in the optic nerve. So optic nerve is formed by the second order neurons or the peripheral central processes of the ganglionic cell layer. This is the ninth layer. This neurons form the ninth layer, and the inner one, the 10th layer, is the internal limiting membrane. Okay, so that was about the passage of light through retina. Next is about optic nerve dimensions. So optic nerve dimensions, let's again draw this diagram first. This you are saying is the eyeball, right? This is the eyeball, and this is the optic nerve, and then after emerging out, the nasal fibers decussate through the optic chiasma, while the temporal fibers, they continue ipsilaterally in this optic tract. This is optic chiasma and this is optic nerve. Got it? So, and you also know that this is the medial wall of the orbit, and sorry, draw it like this. This is the medial wall of the orbit and this is the lateral wall of the orbit, and this will be the optic canal through which it is passing. Okay, then the dimensions basically I have to tell here. This course of the optic nerve within the orbit, this is called intraorbital portion, and this is around 25 millimeters in length. And this portion here is the intracanalicular portion of the optic nerve, and it is around 5 millimeters. And then you are seeing is this portion of the optic nerve. This is intracranial. This is intracranial portion of the optic nerve, and this is around 10 millimeters. Okay, so how much is the total length? You can calculate it there, and don't forget that there is this portion of optic nerve also, which is part of the optic disc, and through the lamina cribrosa, remember, it is passing through the choroid and then sclera that forms the lamina cribrosa. So there is this portion of optic nerve also, and this is called intraocular or intrabulbar, you can say, is around 1 millimeter. So total, remember, the total length of the optic nerve will be 41 millimeter, or you can say around 4 centimeter. Okay, now about the relation of the optic nerve with the ophthalmic artery. That is also very important. So once again I am drawing here is the orbit, the two margins of the orbit, right? And this is the eyeball, and this is the optic nerve, yes. So remember, in the optic canal, the ophthalmic artery enters this orbit through the optic canal. The ophthalmic artery is a branch of internal carotid artery, and it enters the orbit through the optic canal. And this relationship here in the optic canal, remember that this is the optic canal. So here the relation I am talking is that the artery is you can say is infrolateral. So ophthalmic artery passes infralaterally to the optic nerve in the optic canal. Now further what happens is, in the orbits, this ophthalmic artery, it crosses from lateral, it ascends up from lateral to medial side, and it crosses above the optic nerve, crosses superiorly, and then it runs along the medial wall of the orbit. But before it crosses, it gives its lateral branch, and that's the lacrimal branch of the ophthalmic artery. And of course, before everything, there is a branch given from this ophthalmic artery down below, and that's called the central artery of retina. And it also gives another branch which runs above and passes this supraorbital margin through the supraorbital sulcus or the foramen, and it descends and supplies the skin of the forehead and the scalp, and this is supraorbital, this is supraorbital branch ophthalmic, this is lacrimal branch of ophthalmic artery, and this is the main branch. The ophthalmic artery, it divides into two branches, angular and the intratrochlear, so this is supratrochlear, and this is angular branch, and there between it gives two more branches. These are anterior ethmoidal and posterior ethmoidal branches. By the way, the important thing is in relations with optic nerve, so I think I should draw a different diagram so that you can remember, and it's this way I'm drawing here. This is the optic nerve, and this is the eyeball, right? And you can say that this is the optic canal through which it is entering. And as I told you, this I'm drawing it like here in a dot, this is the ophthalmic artery, and ophthalmic artery enters infralaterally to the optic nerve, and then it, as I told you, it ascends up laterally to the optic nerve and then descends down medially, right? That will be the course of the ophthalmic artery. So while it crosses above, then descends down medially, it gives its branch, and this branch is called the central artery of retina. The central artery of retina, it now perforates the optic nerve and becomes intraneural. This artery then travels within the optic nerve and enters the optic disc and then supplies the retina on the inner side. I believe you have got to know this relationship is important to understand. So, if in its case the initial relationship of ophthalmic artery to optic nerve is infrolateral. And what is the relation of central artery of retina to optic nerve? You can say is here it is infromedial. That is important. So central artery of retina is running, it does not immediately pierces, rather it first runs for a short distance infromedially to the optic nerve, and then it perforates this pia mater, then epineurium, and then it continues within the substance of the optic nerve. By the way, I cannot ask you, it's a monologue type of lecture when I'm just speaking, but I wanted to ask you if you know any other nerve which has an artery running within its substance. One example is optic nerve, where there is an artery running within the nerve. Any other example? Yes, don't. If people whom have taught, they must be remembering that I told you the largest nerve of the human body, and that is sciatic nerve. And sciatic nerve, when it emerges out from the greater sciatic foramen and reaches the gluteal region, its thickness is around 2 centimeters. Imagine how thick it is. And the reason of, and then the artery to sciatic nerve, artery to sciatic nerve is a branch of inferior gluteal artery. And this artery to sciatic nerve is also called the axial artery of lower limbs. So artery to sciatic nerve, if it's not in the choice, then there will be inferior gluteal artery, that you can mark as the axial artery of the lower limbs. So that artery also runs within the substance of the sciatic nerve. But remember, the purpose there and here is different. Here the central artery of retina is running within the optic nerve. That's the purpose here is to reach the inside of the eyeball to supply the retina from the inside. Okay, and there in the sciatic nerve, the artery to sciatic nerve enters the sciatic nerve. The reason is that the bulk of the nervous tissue is so much, right? It's 2 centimeters, you can imagine thickness. So it has, the peripheral perfusion of the nerve is not enough. So that artery goes inside the sciatic nerve and perfuses blood from the inside as well. Okay. So if you have ever seen, or if you may see in future, there is above knee amputation. When there is above knee amputation, you will find that the sciatic nerve starts bleeding. So that's the example where you find that a nerve starts bleeding, and to stop this bleeding, you can pinch the the proximal cut end of the sciatic nerve, and you pull it, suddenly pull it, and then you release it. You will find the artery stays inside and the nerve gets pulled, so artery automatically gets compressed. So that's how you can stop the bleeding from sciatic nerve. Okay, so that was just a revision from the past. Okay, let's move to the next slide. Yep, so what I have told you, you can see here also in this diagram. They have shown is the inside of the cranium, and they have cut open the roof of the orbit. So what they are showing is in I believe you are able to read it, right? And if you are not able to read it, let me zoom it. So here it is an intraocular portion of the optic nerve. This they have mentioned here as 1 millimeter, right? Then this is an intraorbital portion of the optic nerve. This this is around 25 millimeter, I told you. Then this is an intracanalicular portion of the optic nerve, which I told you was around 5 millimeter. Let me tell you, as many books you will follow, you will find some variations in these lengths, because this is actually the domain of the research scholars who actually work upon this and bring out this data. So there might be some variations in different editions, and I believe for your convenience you remember this formula, this measurements which I am telling is because it makes an average of 4 centimeters, so it will be easy to remember for you. So intracanalicular length is around 5 millimeters, and then intracranial portion they have shown is 16, but it's, you can remember, it's around 10 millimeters, right? Okay, so but everything, this has some variations, but the entire thing in gist you are seeing that this has to be a lax course, ढीला ढाला, थोड़ा सा loose होना चाहिए. The reason is, so that when you move the eyeball, right? So when you move the eyeball, there shouldn't be any strain on the optic nerve. Got it? So now you see in this different diagram, there you have shown here is the eyeball, and then this is the optic disc. So this portion here is this is so this is intraocular or intrabulbar portion, which is passing through the layers of the eyeball, and it's around 1 millimeter. And this is intraorbital portion, which they have shown here is how much, 16 millimeter, and here they have shown is 25 millimeters. So what is the difference that they have shown is 16 millimeter here and 25 millimeter here? Can anybody guess by now? The reason, let me tell you, that in physics classes, in your classes, while you were studying physics, you must have been taught about the difference between distance and displacement, right? So distance was the shortest measurement between 2 points, and displacement is like any course you take from the first point to reach the second point. So that is the difference here also, because the important thing is the optic nerve in its intraorbital course is not straight. It has a curved course. So that's why the length of optic nerve in the intraorbital portion is 25 millimeter, but the distance is 16 millimeter, right? So that means you are getting 25 minus 16 is around 9. So 9 millimeter of the length of the optic nerve is spare. It's spare and free for the freedom of movement of eyeball. So you can move the eyeball freely. Imagine if it would have been like just 16 millimeter in length, would if any condition if there be retrobulbar neuritis or any edema, there would be stretching of the optic nerve if it would have straight in its course, and your movement would be restricted, and it would be a painful movement. And remember, if there was limited length in the orbits, then there would have been more chances for ischemia also and stretching of the axons. So that's why, to provide a freedom of movement of the eyeball, this intraorbital portion of optic nerve is sigmoid. This is called sigmoid course. This is called sigmoid course of the optic nerve in the orbits. Next is the intracanalicular portion. Intracanalicular portion, don't get confused with these digits. Just remember what I told you is 5 millimeters is the intraorbital course, and then this is the intracranial course. Intracranial, I told you, you can remember as 10 millimeters. This is the intracranial course of the optic nerve. And so total length, again total length kitna ho gaya, 41 millimeters, around 4 centimeters is the length of optic nerve up till the optic chiasma. Okay. Next you are seeing is the optic nerve and its relation with the central artery of retina. You know that central artery of retina is a branch of ophthalmic artery, right? I just showed you before in the previous slides. And ophthalmic artery is a branch of, so ophthalmic artery is a branch of intracranial portion of internal carotid artery. And you know ophthalmic artery, you know all these vessels, the cerebral vessels, they are all content of subarachnoid space. They all are covered by meninges. So middle meningeal, anterior, no, don't forget, confuse with the meninges. These are the cerebral. So anterior cerebral, posterior cerebral, middle cerebral, and even the internal carotids, they are all covered by meninges. So imagine this ophthalmic artery, which is given out just medial to the anterior clinoid process, and it has a very short intracranial course. So this also will be covered by meninges. So that means when it enters the orbits through the optic canal, it also is covered by meninges, right? So if it's asked, and then remember this meningeal sheath, you can see in the diagram also that this meningeal sheath covering this optic nerve right from the brain, it is intracranial portion, it continues up to the posterior pole of the eyeball. That means the entire course of the optic nerve is within the meningeal sheath, and it is covered by CSF. And both these pure sensory nerves, like even this rather 3 nerves, the ophthalmic, optic, and the vestibulocochlear, the meningeal sheaths, all the 3 meningeal sheaths around the vestibulocochlear nerve, they enter into the including the facial nerve also and nervus intermedius. The 3 nerves, when they enter into the internal acoustic meatus, they are all surrounded by the meningeal sheaths. So the 3 special sensory nerves and the accompanying structure, like there the additional nerves, and there was labyrinthine artery, don't forget, there was also a structure entering into the internal acoustic meatus. And here it is the ophthalmic artery, which is passing along with this optic nerve through the optic canal. So if it's asked like where actually, then ophthalmic artery gives its various branches like cranial, supraorbital, then ethmoidal and all. So how these, now all of these branches are not covered by meninges. That means somewhere at some point this ophthalmic artery will have to pierce the dural sheath. So where actually it pierces the dural sheath? Remember that in the orbits, after giving its central artery of retina, then after that ophthalmic artery pierces the dural sheath, and then it gives out its other various branches, intraocular branches. So they have not shown about the ophthalmic artery here. Look here, this is the dura mater, pia mater, arachnoid mater, subarachnoid space, right, the blue color thing. So this central artery of retina, as I told you, it passes here, this course here you are seeing is infromedial. So the central artery of retina runs infromedially to the optic nerve in the subarachnoid space. Then if it's asked like where actually it pierces the optic nerve and becomes intraneural artery. So for that, remember the intraorbital portion of the optic nerve was 25 millimeters. So if you divide into 2, that is the midpoint, it's the midpoint, okay. So that means this much portion is 12.5 millimeters and this much portion is 12.5 millimeters. That means if it's asked where actually the central artery of retina becomes intraneural, it is the midpoint, midway in the intraorbital portion of the optic nerve, the central artery of retina pierces this pia mater, and then the epineurium, remember the outer sheath of the nerve, epineurium, and then it from inframedial portion it perforates these structures and becomes intraneural in its course. Then remaining half of the optic nerve, the distal half, it continues within the nerve, and then through the optic disc it enters the eyeball, and there it runs along with, in which layer? In the ninth layer, in the ninth layer of retina, that's the retinal nerve fiber layer, retinal nerve fiber layer. In that layer, this artery gives out its branches. So initially it gives out its two branches, like upper and lower division, central artery of retina within the eyeball. Then it is upper and lower, both these divisions give their nasal and the temporal branches, and a direct branch to the macula, that is the central branch. So 5 branches, named 5 branches are given off, which are the ramified to form the plexus in this ninth layer, and all of it will be covered from inside. Don't forget that there will be a layer which will separate all these structures from the vitreous, and that is called internal limiting membrane. Okay, so that is how this is the course. And don't forget one another important thing, that this, all these waste products, right, that has to be brought back, and that is through the venous circulation. So there will be a retinal vein also, and retinal vein will have a similar course, and it will exit out like this. So retinal vein will also follow the same pattern, and it will exit out, and it will ultimately it drains into the superior or by ophthalmic veins and inferior ophthalmic vein. Both the veins, they will run, I will tell you, they are in relation to this optic nerve above and below to the optic nerve. Okay, so superior and inferior ophthalmic vein I will tell you in other slide. I hope you understood this. Okay, now look here, the actual blood supply of the optic nerve. First of all, look here, this is the sclera, right? Deep below you find is the, I think I should zoom it so it becomes more visible. Yes. So can you see it? This is the vein, choroid with the blood plexuses here, capillary plexus. The vascular and pigmented layer of the eyeball is choroid, and outside is the fibrous layer, the sclera. Deep inside is the retina, and this is the fibrous layer of the retina, right? Okay, and the pattern of return of fibers is, I've already told you. So the peripheral fibers will run peripherally in the retina, the central fibers will run centrally in the retina, central retinal fibers will run centrally in the optic nerve. Okay, and this is the artery, you can see it's his intraneural course, the central artery of retina, and it divides into 2 divisions and further branches, as I told you before. Then can you see the nerve? The thickness of the nerve is this much, right? And how many neurons does it carry? That also is important. It carries around 1.2 million nerve fibers. There are 1.2 million nerve fibers running in the optic nerve, and these are the central processes of the ganglion cells. And even if, like, if you say 1 million, that's not wrong. There are variations, this much variations is possible. So 1 to 1.2 million nerve fibers, they are running here. Then important is about the myelination of these fibers. Then let me tell you that the intraocular portion of this second order neurons, the nerve fibers of the retina, which are actually forming the optic nerve, this intraocular portion, these nerve fibers are unmyelinated. These fibers are unmyelinated. But if they are unmyelinated, there will be dissipation of impulses between neurons, right? And there will be loss of energy. So that means the impulse being transmitted through these nerve fibers should be insulated. So these nerve fibers, although they don't have a myelin covering, but they are being insulated by specialized cells, and those are called Muller cells. Muller cells provide insulation to these unmyelinated nerve fibers in their intraocular course. Okay. Then these nerve fibers, they pass out through this cribriform palate and then they form the optic nerve. Now compare the thickness here. So you can see this much is the thickness of the optic nerve, and where at the optic disc, just see how narrow it is. That means these nerve fibers, the number of fibers here and here, both the places is the same. That means here it is compacted up, packed up tightly, gripped, and that's why there are more chances of ischemia at this point, and also maybe some stretch injury is possible at this point. But it's a natural thing, so that has a compensatory mechanism for this blood supply. So look here now, this was the central supply, right? So remember that optic nerve is being perfused by two ways. From inside, it's this central artery of retina providing blood, but from the outside, right? From the outside, if you see, there is this central artery of, this is the ophthalmic nerve of the ophthalmic artery, and there I told you immediately this nerve you are seeing is from the lateral side. So this is the central artery of retina. You see is it perforating this epineurium, the pia and then epineurium, and then it enters this optic nerve and it is running in the center. But this ophthalmic artery also gives its posterior ciliary branches. Okay, so these posterior ciliary branches, they also run along this optic nerve, and when they reach the sclera, they give out their long posterior ciliary arteries and the short posterior ciliary arteries. The short posterior ciliary arteries, they surround this lamina cribrosa, the point of emergence of the optic nerve, and there they give these anastomostic branches, right? These branches are seen around the circumference of this optic nerve at its point of entry into or exit at this point of posterior pole of the at the attachment of the optic nerve, and that forms a circumferential anastomosis around this optic nerve. So as I was telling, because it's packed up, there will be requirement of more oxygen, and so to prevent ischemia. So this forms a circle around this attachment of the optic nerve, and that is called circle of Zinn and von Haller. Very important. This is called circle of Zinn and von Haller. Okay. So you have understood this. Okay, then let's zoom out. I think from this image you can look here the course of ophthalmic artery, but before that, can you guess this optic nerve you're seeing is of which side, left side or the right side? And what is the orientation, like you are looking this nerve from which side? So let me tell you this thing that this is the right optic nerve, and you're seeing this nerve right side here, right? And you're seeing it from the lateral view. So if you're seeing the right optic nerve from the lateral side, what are you seeing here? That this is the course of ophthalmic artery, right? So it is ascending from the lateral side, ascending up and crossing the optic nerve from above, and then you can see it's descending down medially. It's descending down medially. And when it reaches on the medial side, as I told you, it gives its branch, the central artery of retina, and that perforates infromedially to this optic nerve, while the ophthalmic artery, it continues in its course on the medial side, giving its posterior ciliary arteries as well as different other branches. Okay. So that was all about the blood supply of optic nerve. And there these fibers were, these fibers I am talking, they were unmyelinated, right? Unmyelinated. These are unmyelinated, and these fibers in the optic nerve, these are myelinated, but not by the Schwann cells, by oligodendrocytes. Okay, and that's why it's it's a similar structure of any tract of the CNS. And don't forget that other glial cells also, it also has this portion of the optic nerve, not the intrabulbar, but this portion of the optic nerve also has the other glial cells, like the astrocytes, the microglial cells, they are all present here, just like a part of CNS. Okay. Now you are seeing is a dissected specimen of intraorbital portion of the optic nerve. Look here now. This you are seeing is the optic nerve. Can you see here? Can you appreciate the course of this nerve? The important thing here is, like, it's a dissected specimen. So can you see that the nerve is not straight? It is not the distance, it's a displacement sort of thing. That means what I'm saying, it's having a sigmoid course, having a lax course, a looped course within the intraorbital portion, so as to provide the freedom of movement of eyeball. Now look the surrounding relations. Here you seeing is the roof. This is the roof of the orbit. Roof of the orbit is partly formed by the frontal bone. Behind it is from the sphenoid bone as well, right? Now look here now. What is related to the roof of the orbit? It is the frontal lobe of the brain. Then what is, this is the floor, like this is the floor of the orbit, and the floor is formed by the maxilla. Most of it is formed by the maxilla. Posteriorly, it is formed by the sphenoid, and don't forget there is a portion of the palatine bone also participating in the floor. By the way, so down below in this floor you find is the maxillary sinus. Right, this is what I am telling is because in clinical portion you get to know how the infections is spread and reach to the orbits. So this is maxillary sinus. So any sinusitis and infection might also reach up to this portion. And now look here, the other muscles. Look here, this is the sclera of the eyeball, right? This is sclera, and the other muscles. Look here. Now this is inferior rectus muscle, this much portion is inferior rectus muscle, and this one is the superior rectus muscle, right? This is superior rectus muscle, and this muscle is what we call as LPS, levator palpebrae superioris, but some of the authors, the international authors, they even call it as upper eyelid muscle. Okay, so and you can see there is a lot of retrobulbar fat here. The orbit, the posteriorly, it is all filled with retrobulbar fat. This also fixes the position, or you can say it prevents the in ophthalmos, right? So it prevents the sunkening of the eyes. Although there are other factors also, one of them this orbitalis muscle I told you before, which prevents the in an ophthalmos, and that's why in Horner syndrome the eyeball gets sunken in and causes an ophthalmos. Then yep, the relations, when we're talking is about the relations, the important thing is left out. Let me cover that also. And this here you seeing is the optic canal, right, from the posterior view. And don't forget that there is this supraorbital fissure just lateral to that, between the junction of roof and lateral wall and junction of lateral wall and floor. That is how this is formed, like a crack between the roof and wall and floor and lateral wall. So that's the supraorbital fissure. And inside of the orbit, there you will find is a tendinous band. Inside of the orbit will be a tendinous band, because you might not get disoriented. Let me tell you, this is the right side posterior view, right? So this I am drawing is from the right side posterior view. Okay, so that means supraorbital fissures divided into three parts, and that the structures passing through this LFT, lacrimal frontal trochlear nerves. Here will be two divisions of the oculomotor, abducent and nasociliary, passing middle portion mein, and there is this superior ophthalmic vein from the upper portion, inferior ophthalmic vein from the lower portion, and there will be a recurrent branch of ophthalmic artery going back, the recurrent meningeal artery. So the structures passing through the supraorbital portion, supraorbital fissures. Now what passes through this is the optic nerve. This is optic canal, right? And as I told you before, the artery will enter here like this. This is ophthalmic artery, and this is optic nerve. And don't forget that all it will be surrounded by the meninges. They're all covered by meninges, these two structures. Now when they enter into the orbit, what is attached to this green color thing, what I've drawn, is called the tendon of Zinn. Circular tendon of Zinn. And onto this there is attachment, or the origin of the four recti: superior rectus, inferior rectus, medial rectus, and lateral rectus, right? This is how the muscles take origin, from the inside of this ligament and surrounding the optic canal. That means if you dissect out, you will not be able to see this optic nerve until you reflect these muscles from the common annular ring, that is tendon of Zinn. So here also you can write up that this is superiorly covered by superior rectus, right? And above to this will be LPS, like LPS will be here, and superior oblique will be here, right? And inferior oblique, it arises anteriorly from the floor of the orbit. Then another important structure that is being left out is this. Sometimes they ask is about this also. This is inside the orbit, right? And this is called ciliary ganglion. This is called ciliary ganglion. Now this location of ciliary ganglion, if they ask, remember it is located at the apex of the orbit, in between, this, I should draw it, rather I should label it. This is optic nerve and this is lateral rectus. So ciliary ganglion lies between, when you'll find, dissect it out, you'll find ciliary ganglion lodged in the apex of, at the apex of the orbit, between the optic nerve and lateral rectus muscle. That is the location of ciliary ganglion. Okay. So I think this is all about the relations I have taught you. Next, the optic nerve relations with the orbit. This is the way of seeing it. Here you seeing is the through the roof of the orbits. So as you know that ophthalmic artery was running laterally, infralaterally to this nerve, and then ophthalmic artery ascends up laterally, then climbs from the lateral to the it crosses superiorly to the optic nerve and then runs medially. This is the course of ophthalmic artery, and here it will give its branch which will wind down medially and will supply the optic nerve, and that is central artery of retina. So that is the course of ophthalmic artery. Okay, this. Then from lateral to medial, right? And then you will see that I am trying to draw here is this nerve. This nerve is, also having this course from lateral to medial. This nerve is nasociliary nerve, right? And there is a vein running here, and the course of the vein will be like this, from medial to lateral, right? The course of the vein is medial to lateral. So it will be easier for you to remember now, right? It will be easier. The formula is VAN. So the structures crossing superior, the structures in superior and direct relation to the optic nerve from anterior to posterior are VAN, and this is superior ophthalmic vein, then ophthalmic artery, and then nasociliary nerve, right? And now you will see here is what I am drawing here is the the inferior relations of the optic nerve. So inferior relations, I told you before, it will be easy for you to remember. The same pattern will be a vein passing below to this optic nerve, and this course of the vein will be same medial to lateral, and that is inferior ophthalmic vein. Okay, so this is inferior ophthalmic vein, and there will be a nerve also passing below to this nerve, also passing below to this optic nerve, and the nerve will have the similar course from lateral to medial, and this this is the course of the nerve, and this nerve is nerve 2 medial rectus. This nerve to medial rectus, because medial rectus will be placed medially here. So the nerve to medial rectus, it's a branch from the lower division of oculomotor nerve, right? So you've got to know the superior relations and the inferior relations of the optic nerve within the orbit. Okay. Now this is like we've done with the orbits, we've done with the optic canal. Now we've reached to the intracranial portion of the optic nerve. And here you seeing is the intracranial portion of the optic nerve. This much is the intracranial portion of the optic nerve, and this is around 10 millimeters. So they form a decussation here, that's called optic chiasma. Then fibers from the nasal retina, they decussate and reach to the opposite side. The fibers from the temporal portion of the retina, they run ipsilaterally, and then they form this optic tract. Okay, and then the optic tract will wind laterally to the midbrain and will reach backside to the LGB, the lateral geniculate bodies, right? So remember, in optic chiasma around 53%, around 53% fibers decussate. Or you can add optic chiasma. That means the nasal fibers, right? while the later ones, you know, they reach to the optic tract crossing ipsilaterally, and ultimately they will relay in the, you know, these were the these are all the second order neurons which were running down here in the optic nerve. So they will relay here. Where will they relay? In the LGB, right? Okay, so that was about the attachment of the, how you will find this optic nerve. And this first and second, you can see this is the first nerve and this is the second, you know, olfactory pathway, optic pathway. They are from the forebrain, and remaining 3 to 12 they are branches arising from the, they are the nerves arising from the brain stem. Okay, now in this just to identify a structure, when you see the medial view of the cerebral hemisphere, down below here you seeing is the lower portion of the diencephalon. Here you find from this a stalk from the hypophysis, you know, below the hypothalamus there is a hypophysis cerebri, the infundibulum and the pituitary suspended, and anterior to that you will find is the optic chiasma. Okay, so optic pathway, this I will teach you in my next lecture, but just a brief idea about what is optic pathway. Here you seeing is the nasal fibers of the retina, they cross and then they reach the contralateral LGB, lateral geniculate body, right? So the from both the eyes they decussate and they reach the LGB of the opposite side, while the temporal portion fibers of the retina, they do not cross and they run ipsilaterally and reach the lateral geniculate body of the same side. So through this, now this is optic tract, right, having different fibers compared to the optic nerve. Now this you know, most of the fibers they will relay here, and they will relay here, like, you know, this is LGB both the sides, right, and this is the second order neurons which will relay here. This is second order neurons, and the third order neurons will pass from here, right? The third order neurons will pass down here, and this is forming the optic radiation. This is forming the third order neurons are forming the optic radiations, and they will reach into the visual cortex or the visual stria, area number 17, Brodmann's area 17, that's visual stria of Guinari दी होता है यहाँ पे. Okay, so you are seeing this is the pathway that from retina, that's the photoreceptors, the fibers of these are the first order neurons are the bipolar neurons, then the second order neurons are neurons on the ganglionic cell, and then the third order neurons from LGB, they will pass to the cerebral cortex, that is the primary visual area. Okay, so that is done. Just a few points about the clinical anatomy. Okay, now what is optic neuritis? As I told you, the relations of the orbit and the optic nerve in detail. Now imagine like what are the surrounding and what can be the source of infection, right? So any septic focus in the orbit or around the orbit can lead to infection of the optic nerve and can cause inflammation there, like, you know, from the teeth, infection of the teeth, infection of maxillary sinus, infection from the nose. Remember, maxillary sinus was below the floor of the orbit, and this, you know, if you talk about the nerve supply of the tip of the nose, and that is from the V1 division, that is external nasal nerve, which is a continuation of anterior ethmoidal nerve, and anterior ethmoidal nerve passes through the anterior cranial fossa, then through the medial wall of the orbit. So that can also be a cause of infection. Remember syphilis, like syphilis grade 3, that also runs reaches to the CNS, and GB syndrome and encephalitis, meningitis, like, you know, intracranial portion severe infections possible because there is opening, you know, superior orbital fissure, optic canal and all, Anyway, so in all these, and don't forget that demyelinating conditions may vitamin B deficiency, especially vitamin B12 deficiency is very important for the demyelinating condition. Anyways, in these all conditions there might be irritation and inflammation of the optic nerve, which might be a cause of painful movements of the eyes. So the patient will complain of painful movement of the eyes. So what can you check is, you as an examiner, as an ophthalmologist, you can observe the fundus of ophthalmoscope, and you will find, you may not find very much marked that is papilledema. The reason is papilledema is most pronounced in case of intracranial tensions, increased intracranial pressures. But because it's not it's just an neuritis, so the papilledema is not very much marked. So in case if you don't find the papilledema, you can reassure yourself by pressing over the eyeball. If on pressing the eyeball there is, the patient complains of pain behind the eyeball, that is retrobulbar neuritis. Okay, then that was about the optic neuritis. And optic nerve has no neural sheath, that I told you, because there is no Schwann cell surrounding, so no neural sheath, so no repairment of the axonal damage, and so that's why this nerve, if damaged, it does not regenerate. That's another important one. Optic atrophy can happen either developmentally, since a primary cause, or might be secondary cause, or to any sort of damage or any sort of ischemic or you can say or demyelinating conditions. They might also lead to optic atrophy. So ultimately I have completed this chapter, this topic of clinical anatomy, and this optic nerve has been completed. Okay, thank you.